Hey, good afternoon, everyone. Teacher Y'all, 5:45 now, and hopefully everyone has done well after the hurricane. Dr. Keiser, you and I were talking that you've got to get a new roof now,
Yeah.
thanks to Hurricane Nicholas, which is why we didn't have the show last week, as Nicholas was making landfall about that time and
That's right.
hitting our area pretty hard. So we felt it was probably best we hold off a week and get the show going. We are going about half an hour earlier because Dr. Keiser does need to be out by 3 o'clock today. So we're going to jump into this one early on.
TJ, please don't take this the wrong way, but I didn't even notice we didn't have the show last week. But
yeah, too busy, right?
All right.
One of the things is, and we have a tight show today, but one of the things that comes with a hurricane time is the general health issues. Now, we can put COVID aside. There's always a concern with just general health issues. One, there was a lot of surprise. We were expecting flooding, maybe, but not the power outages and wind damages we had. So I was all prepared to talk to you about, hey, if people have been walking in floodwaters and everything else like we normally do after these, but really it's more of a what should people do with the food that was in the refrigerator, I guess, is to ask you about that more than anything else.
Yeah. Well, if your refrigerator failed, you should throw it out. Don't take a chance in it, because if you have meat that's even warmed up to room temperature for any period of time, the bacteria can grow and it can make you sick. And we make restaurants do that. If they have power failures and they have a lot of meat that's been sitting around, they got to throw it out. That's the law. So do the same thing for yourself and save yourself some trouble.
See, that's always good, and that's what we ended up doing too. I mean, it became this is the line I use on the to keep healthy. I said the one good thing when you lose power for several days, as we did where I live after a hurricane, is that your refrigerator becomes a blank canvas. And you expect you're going to go put all this healthy food in there. Well, guess what? That's not what happened here in any case. But we'll get into that. But as I said, hopefully everyone who's watching this there, take Dr. Keiser's advice. If you were holding on to that frozen pizza or anything else, if it sat in your refrigerator for a while and you lost power, it's probably good. Just don't hold on to it. Throw it away. And to be safe. Let's get into the COVID-19 issues. A lot of stuff to unpack there. As I said, Dr. Keiser has to leave at 3. One of the things is the latest report, taking a look at daily deaths in the United States from COVID-19, averaging 2,000 a day. Texas, 353 a day. There's been a total now of 499 deaths, reporting one more today. In fact, someone who was not vaccinated. And that's the 499 is a total since March of last year. But what you're telling me is that we're averaging like 2 to 3 a day now.
Oh, easily. I mean, tomorrow we're probably going to report anywhere between 12 and 13 if we can verify them all. And they tend to come in waves like that, surprisingly. We have some days where we only have a few, and then some days where we have a lot. And part of it is just, it takes time to catch up to get these things reported. But it shouldn't be surprising that we're seeing this number of deaths, given the number of people we're seeing in the hospital. And I think we will continue to see high death rates, even though our numbers are going down for at least the next several weeks, if not the next month or so.
And is it still holding true that deaths right now are among, obviously, the underlying conditions is still preeminent in those, but that what we're seeing is that it's those who are unvaccinated.
Sure, it's those, primarily those who are unvaccinated. We have a few of people that have been vaccinated that have died. It's in the low teens now. I think it may be up to about 13 or 14, by the end of tomorrow. But contrast that we've vaccinated almost 200,000 people. So when you look at those numbers, the vaccine remains the best way to avoid dying, to avoid getting in the hospital, or to avoid getting sick.
And right now you're seeing on your screen, folks, is kind of the bigger shift. The highest number of cases are those between 51 and 70 this is current numbers. Galveston County residents in the hospital. Doesn't mean they're in a Galveston County hospital, by the way. These are Galveston County residents who are hospitalized with confirmed cases of COVID. That larger age group is that 51 to 70, but we're seeing more and more in that 31 to 50-year-old range as well. That's continuing to trend up here And that's the bigger thing that's been the concern of hospitalizations this summer with the Delta variant and as we're watching that, is that not this younger
Yeah.
population?
Yeah, younger people getting sick, younger people getting in the hospital. Last week, our single biggest group of people that had infections were under 10, and then followed by under 20. And if you look at under 40, it was over 50% of the population. So it's affecting a much younger age group than it has before. And then when we look at hospitalizations and deaths, we're seeing shifts down toward younger ages. If you recall, last year, everybody that was dying was, in their 70s and 80s. And when we had a 60-year-old, we'd say, oh my, it was someone who was younger died. And now we're seeing, even 20-year-olds have died from COVID. And so as the virus infects younger groups of people who are unvaccinated, they also have their share of them that will get very sick and that will die.
And as you said, you're expecting when we get the new numbers are released tomorrow at noon, we have one new death to confirm today, but with tomorrow there's going to be a large group, so to be braced for.
That's right.
Is that following kind of the same trend you're saying, some younger folks and mostly unvaccinated?
Mostly unvaccinated. I think there may be one or two vaccinated in that group, but again, the number of vaccinated total is very, very low compared to the number of people that have been vaccinated.
And again, if you're just joining us, Dr. Philip Keiser, the local health authority and the interim director of the Galveston County Health District, is joining us right now. A positive sign, though, we should say, is the number of positive cases per week is trending downward now. Talk about that. What do you think accounts for that? Is it just as when we saw that that number jump up on us, that folks are taking some precautions better, more people got vaccinated, or what would you say? What would you attribute that to right now?
I think it's a yes and. I think it's a little bit of everything. It's interesting. It's this phenomenon we're seeing all over the world, is that with the Delta variant, it's tending to jump up really quick. And then when it decides to go away, it drops down very quickly. It's not this lingering thing that we've seen in the past. And so, we're seeing more people getting vaccinated. We have a few thousand every week. We're up to almost 70%. We're like 69.8% of people with one dose in their arm for all the eligible people that are in the county. So that's very good news right there. And also we see people being more careful as the numbers go up. People pay attention to these numbers very carefully, and they modulate their behavior because of it, and you are and what you're doing so that you avoid dangerous situations.
And what you're looking at now, folks, on your screen is I went ahead and adjusted the timelines. Essentially, 1 year ago to close to now here. It actually starting on October 1st of last year, and you can see that trend go up. We had that spike that happened between January and February. Then we started seeing vaccines starting to take a hold this year, drop down. We had the big dip that happened in March or so, the increases that happened. We got to the summer, and then that's the August spike. That July and August spike went way up and then went up and down. But now we're seeing a downward trend here, and that's what we're talking about. These are the daily positives. And testing, is testing still going kind of steady, or are we seeing fewer tests being conducted now?
Yeah, we're seeing still thousands of tests a day. So people are still actively being tested. And, there's two drives to get testing. Number one is that people are worried because they may have been exposed, or through contact tracing, they've been told that they need to get tested. But more and more, we're seeing businesses and hospitals and cruise lines and international travel all require testing before you travel. So we're still seeing that steady drive of testing. So for example, today I looked at the UTMB lab report, and they performed over 2,000 tests the day before. Now, at its peak, at the height of this, there were about 4,000 tests a day. But we're still seeing really a lot of people want to get tested.
Let's get into another question. We have a question now from Carrie Hagee, I should say. This was one of the questions on our list to ask you today, and asking about the vaccine approved for the kiddos, and also booster clarifications. Two things we were going to touch on today. One, let's get into first for the kids. Pfizer coming out and talking about it's found a vaccine for 5 to 11-year-olds. It's a little less of a dosage than what the adults are get. From what you study, what you've seen on that, how promising is that to have at least that age group from 5 to 11?
Oh, I think it's going to happen. And if you look at their study, what they did is they took about half the dose, a third to half the dose, depending on the size of the kid. And they had a very suitable side effect profile. You know, one of the things that was of great concern in developing this vaccine for children was the issue of side effects, because people are very concerned about that. And also because the risk of having a bad outcome with COVID is lower than with an adult. So they want to make sure that it's going to be safe for these children. And I think they've been able to demonstrate that it's both safe and effective. It helps prevent COVID, and it also has a good safety protocol. When can we expect to see it? The things that we're hearing is sometime of probably about the end of next month. We're almost to the end of this month, but maybe 4 to 5 weeks from now, we'll be able to have the vaccine. And as soon as it is approved, we will start vaccinating children.
One of the things too, and she asked about booster shots. We're getting, kind of last week, an FDA advisory panel, should point out it's an advisory panel, it's not the FDA itself, had come out and said, all right, limited population for booster shots, certain age bracket, and those who are immune compromised. But do you really, while the recommendation was immune compromised, be those who got first, and there was going to be a date on that and everything else. This seems to even limit it even more so on there. Do you agree with that? Or do you think, because, quite frankly, if you were going to the drive-through at the drive-up vaccination site, the health district, there wasn't a whole lot of questioning about whether you're immune compromised or not, or what your age was. You were getting the booster if you wanted it. What would you think that really went to the FDA advisory panel's decision on that?
Yeah, so the first thing is that we've always followed the FDA guidelines in terms of what we have said that people were eligible for. And so initially it was for immune compromised people, but we have taken the position that we're not the immune compromised police. If you attest to it and say that you need the vaccine, we're going to take your word from it. And the state has told us that that's what we should do. We don't want to find ourselves in a situation where someone may be coming through and we go, oh, nope, you didn't check off the wrong box, or are you really that immune compromised? We don't want to get into that. We want to make sure that people who need it are getting it. Will some people, overplay their immune status? Of course. Will some people even lie about it? Of course, right? But that's okay. My personal opinion is that we're heading toward getting everybody a booster. And I think that's going to happen. And I think what we're seeing the FDA doing is doing it in stages. Now, in Israel, they have decided to give boosters to their entire population. In Great Britain, they've decided to give boosters to everyone 50 or older. In the United States right now, it is above 50, it's 65. But what I think we can expect to see is that there will be more data that's coming out. And as that data comes out, then you will see that the FDA will loosen it up, and that we'll see it be going to younger and younger people. One of the things that people need to realize is that according to federal law, in order for things to be approved in the United States, to get a formal approval, there has to be studies that are done in the United States as well as overseas. So we can't just accept the data from Israel, the data from Great Britain. We have to have our own studies as well. And I think that is what the FDA is waiting for. So they're taking a slow, incremental approach to doing this. So once we get the approval for age 65, anyone that's age 65 or older will be free to come and get vaccinated. And again, if people are willing to say that I'm immune suppressed and they have a condition and they tell us that, we're going to take their word for it and we'll give them the vaccine.
Again, I didn't want to give the intention that you were not following what the
guidelines were. But
it was not one of those things that someone had to have hard proof of when they came in.
No, that's correct. That's correct, right? And but people are asking that, and people have asked that question. Well, what are you really doing? And and so we're trying to. We have a hard balancing act to do. We want to stay as faithful to the EUA, to the emergency use authorization, and to the state guidance and the CDC and FDA guidance, while at the same time making it practical for people to get their vaccine.
And the other to ask is Moderna this week is talking about that they're showing better results on that, and it becomes kind of this one-upmanship. And then some of the studies are coming out showing that Moderna may be effective for longer, particularly.
Right.
Is it the better of the vaccines that are out there right now?
Maybe.
That's the tough one, right?
That's a tough one. So it's like this. It's it's like when you see two teams playing, which one is better? When you see two racehorses, which one is better? The bottom line, until we have that head-to-head study, that match race, that that World Series, we're never going to know exactly which one is better. Thus far, Moderna has the edge. That doesn't mean that people who have Pfizer need to go, oh, darn, I knew I should have had Moderna, because the Pfizer vaccine works extremely well. The differences that we see between the two are differences in a few percentage points. And then when we actually look at that margin of error, we're all familiar with this with political polls, right? Well, the same thing happens with vaccines. They actually overlap. So, who's to say which one is really the better one?
Here's a good question. Donna Giusti asked this question. I've been asked this a lot too. If you got your first shot and then you got COVID a few days before your second shot, do you have to start all over again or not worrying about getting the second dose? This goes in kind of a two-part of getting COVID in between the shots.
Right.
The second part of it goes into how much immunity do you get having had COVID on there. What would you, for Donna and others that may ask that question?
Well, we know that getting COVID does give people some immunity. But we also know that the immunity that you get with COVID may not be as good and probably isn't as good as being fully vaccinated. Okay. So now we have a situation where someone gets a vaccine. We know that they're not fully immune with one shot. They get COVID. Okay. So what that tells me was that in that particular person, and this isn't the same for everybody, but for that particular person, that the vaccine wasn't enough to keep them from getting COVID, right? And so they don't have enough immunity. So then they get COVID, so their immunity is boosted. We don't recommend that people get a vaccine while they're sick, but I would recommend that they finish out their shot and get their second shot after they've fully recovered from the COVID.
And here's a good one too. I thought was good. We've been talking about treatments once someone has COVID. We've talked about the infusion therapy. Folks talking about Regeneron. I saw the same thing that is now in short supply. We also know too is that the White House has said that they may start cracking down on how states use the infusion therapy, how making it available. What do we know on Regeneron and on infusion therapy about availability, supply, and when it should or shouldn't be applied?
Yeah, well, currently we still have some. We have plenty. But, we're going through it, or we had been going through it very quickly. So we needed to get it replenished on a daily basis. The new system, we've done our first order under the new system at UTMB, and we got enough vials. How long that will last, we honestly don't know. And everybody's concerned about that. And we don't know what the state is going to do. So the federal government is putting it on the individual states to divvy it up. And they said they're going to try and do it fairly, but there may not be enough supply. We haven't run out yet. We haven't run into shortages yet. So if you have COVID and you're feeling sick, you should definitely consider getting Regeneron. And how do you get that? Well, there's a variety of pathways. The best thing is to consult your doctor to see if you'll fulfill the criteria. What we want to give it to, the best time to give it to someone is someone who has risk factors for not doing well for COVID and who is symptomatically ill, but not so sick that they need to be in the hospital. So, and you can go, well, how do I know if I need to be in the hospital and all those types of questions? Well, the answer is that's why it's best to call your doctor, and that's where you can get the best results. UTMB does have a hotline that you can call, and a nurse will walk you through the symptoms and then schedule you for an infusion if you need one. Right now, we're trying to be as liberal as we can in terms of interpreting the criteria for getting Regeneron, but it can be difficult because you could take 5 sick people and present them to 5 different doctors and get 25 different opinions on whether each one of those 5 people should get Regeneron in that case. So it's not necessarily an easy thing. But we do know that the more people we treat, the less likely people are to end up in the hospital. So we're trying to keep this as broad as possible while still remaining faithful to the criteria.
Good question here from Susan about what about treatments prior to hospital for COVID? What do you recommend?
Yeah.
We've been talking about some of that, but someone had also asked, we get this question every week, and is about what to do for your immune system overall. What can folks do just to make themselves maybe less susceptible to getting sick outside of the vaccination?
Right. So the number one thing is just to be healthy, and that's really easy to say, but can be a hard thing to do. So if you find yourself getting sick, go home, rest, drink lots of fluids, make sure you're well hydrated. It's amazing how many people we see with COVID are actually very dehydrated, and that's why they feel bad. And once we give them hydration, they feel a lot better. Give them some IV fluids. So make sure you're well hydrated. Take fluids, take Tylenol, take vitamins, and then also see if you're eligible for the IV infusion. That's an outpatient procedure. You can either get it as an infusion or you can get it as injections. It's 4 injections, and there's some people, including myself, would rather have just 1 stick as opposed to 4. But there are other people who would say, "Oh, I only have to wait, 10 minutes as opposed to being there for 3 hours," and they go, "Yeah, I'd like to do it that way." Right. Those are the main things that we would recommend at this point.
And another one that's been coming up is, and this is going to lead to another question I have is, so Anita Chris asked, I would be interested in knowing how many people have been infected a second time, irregardless of the vaccination status. We're hearing a little bit, it's not a mass number, but we're hearing more and more of folks I got COVID again.
Right. It's about, I can give you an estimate of that number. It's about 1,500, about 1,000 people that have been, well, no, let me back up. Been infected a second time regardless of vaccination status. It's about 500 people. And some of them actually had been infected again and not vaccinated. And some actually got COVID, got vaccinated, and were infected again. But right now that number is limited to about 500.
Kristen Allen asked this, and I got this question a whole lot last week when folks were asking me, wanting me to ask you this question. Has there been any studies you know of about those who have epilepsy patients? Those are parents that are really concerned that I'm hearing that from a lot from parents about their child had epilepsy or epileptic seizures.
Mm-hmm.
What do we know about the ties on the studies about any of the vaccines to if they're safe for folks there?
Yeah, I'm not aware of any specific studies looking specifically at giving it to people with epilepsy, whether as children or adults. But I can tell you that looking at the database, which is a national database with 100 million people in it, of side effects and reactions, there has not been epilepsy has not come out as a group that you shouldn't vaccinate or that you would expect to have a problem with. Again, my advice would be it's probably okay, but if you're unsure, talk to your doctor, see if there's anything in particular about your child's illness that would make your doctor concerned about getting them vaccinated.
Speaking of vaccines, Johnson & Johnson today, that was the big thing about Johnson & Johnson is you get the 1 shot and you're done. And now Johnson & Johnson says, well, we think you should get a booster now. So maybe it's 2 shots in there. They say it's really effective. The data that they released today showed a lot of promise. And that goes into a bigger kind of, I think, an overall question I ask is that what we know now, obviously this is going to change a year from now, 2 years from now, 3 years from now. What we know now, is this going to become the flu type of approach, which is where you need to have a vaccination every year of some sort to really hold it off?
Yeah.
Or I'm not hold it off. I don't want to give them a number here. lower the chance of being hospitalized, getting real sick, because that's the real goal here, the vaccination. It's not to keep you from getting it.
It's hard to know. It wouldn't surprise me one way or the other. The results we're seeing in terms of the antibody responses after the third vaccine are really remarkable. How sustainable that is, we don't know. Whether you're going to need one in a year or you're going to need it in 2 years, who knows? But it wouldn't surprise me if that happens. But it also wouldn't surprise me if these vaccines hold up for a very long time.
Yeah. Again, another question about what to do here to strengthen you. Someone's talking about a vitamin serum to come in. I've seen a couple of clinics promote this, where it's a different type of infusion. It's basically in a vitamin injection or infusion of some sort. Right. You've said in the past, hey, taking more vitamins doesn't doesn't necessarily protect you though any better.
Right, that's true. And particularly these IV things, people, we use them in the medical community for people that are severely malnourished or people that have reason to be vitamin deficient. But as a general rule of thumb, getting your vitamins from an IV versus taking them PO versus just eating well really doesn't make a whole heck of a lot of difference. So if you were to say to me, eat a lot of citrus fruit and you do that every day, you're getting more than enough vitamin C that you would need.
But then you've said it doesn't hurt to take vitamins, because like Chris Brown's asking, how about zinc and other kind of over-the-counter type of things to do to help boost your immune system?
As long as you don't take them to excess. I remember when I was a young doctor, there was a nurse who worked in the ICU who was just totally addicted to taking beta-carotene, and he turned orange. That's no joke. He had so much of it in his system that he looked like a carrot. So there are side effects. Some of the vitamins you can take too much, and they cause syndromes called hypervitaminosis. So as long as you stick within the recommended guidelines, you're going to be okay.
One of the things too is, and this is the tough one, that one part of this is tough to track, homeless folks who are being sick or coming down with COVID. And then jail related. We keep hearing stories every week. Oh, they're not doing anything for anyone in the jail population. You check on that one personally, I know.
Yeah.
Can you talk about those two, I lack of better terms, populations?
Sure.
Of where it is in the homeless population, and as well as those who are incarcerated.
Yeah, so let me do the jail first. We regularly go into the jail and do vaccinations. We try to do it at least once a month. We did one last week. And had a large group of people that decided to get vaccinated. The things with jails, it's important to realize that it's pretty much a transient population. The number of people that stay there more than 3 days is actually quite small compared to the number of people that go in and out. And that's part of the reason why we keep going back, because we not only want to get those people that may be in there for 6 months or a year, we also want to get those people that are just going to be there for a few days, because while they're quote unquote a captive population, they may want to get vaccinated. So we're working on that on a regular basis. We also have done some regular vaccinations among the homeless populations, particularly at something called St. Luke's Clinic in Galveston. It's a street clinic, and we've done that on several occasions, and we work with the Salvation Army. Surprisingly, though, we have not seen that much COVID in the homeless population. It is a rare event to have a patient at UTMB who gets admitted with COVID, and then when it's time to go home, we get the call that we've got this homeless guy, but he still needs quarantine, and we don't know where to put him. I think that's probably happened twice in the last 18 months. So it doesn't happen that much. And in large part because many of the homeless folks actually stay to themselves, and so they're much less likely to get COVID because of that.
Dr. Philip Keiser, the local health authority, Galveston County, joining us right now and getting more information. We're taking a lot of questions today in there. And this was one that we've talked about several times. Almost all the deaths in Galveston County now show unvaccinated. That's the majority of them. And a few fully vaccinated, but always with underlying conditions.
Of course.
What are those conditions?
Sure.
It seems almost all deaths. And so there's always just kind of, because of health privacy, you're not trying to give that away.
Right.
But I wonder though, can you in general talk about what a lot of those underlying conditions are
Sure.
that are also mentioned in there?
Sure. So we don't mention the underlying conditions in the specifics of an individual. Notice that we don't give their age, and we don't give the specifics under the underlying conditions, because if we did, somebody could figure it out pretty quick. They know somebody who was in their 80s or 70s or 60s who died, and they had this, that, and the other thing. Oh, that's them, right? So we avoid doing that. But the common things that we see are obesity, untreated diabetes. Those are the two top things. Then we see people with lung disease, people with heart disease, people that have some form of immune suppression, whether they're actively undergoing cancer chemotherapy, whether they've had a transplant. Those are the main things that we see. Each case is different, and each case is reviewed to see what those underlying conditions are, so we can keep track of them.
And again, that's one that is really good for folks, being that, and Christy Newell just brought it up. Being overweight is problematic. There's lung disease, COPD, asthma, diabetes too. And you said for some reason, I mean, we do know of several cases in which people who have passed away, their family, like I said, diabetic and had an underlying condition there to go around there. Mel Conroy asked the question we get every single time: what about the schools? And what about the schools right now, Dr. Keiser?
Well, we're actually seeing a decrease in the number of cases in schools. We've seen for several weeks now. They peaked at about week 4, and then week 5 and week 6. Those numbers have decreased. We meet with the school superintendents on a regular basis to discuss ways that they can deal with COVID, and also have consultations on an individual basis. And our epidemiologists are in constant contact with the school nurses to talk through cases. So far, so good. With schools, I think all of the schools really are trying to encourage masking and encourage social distancing. Obviously, they can't do it for every kid, every place, every time, but they are working very hard to do that. So I'm pleased with that. I'm optimistic that once the vaccine gets out, that we'll again be able to work with the schools and get as many kids vaccinated as we possibly can once the new vaccine is available.
This is our first time to talk to you since the 4-year-old Bay Cliff girl, Kaylee Cook, died, and originally was told by COVID-19. Since then, is backed up to double check on that right now. I was wondering if you could go ahead and give us an update on where that investigation and where that case stands right now.
Yeah, well, so the autopsy results still have not come in as a final diagnosis yet, and there are lots of tests that some of them have to be sent out to outside labs, and so it may actually be several weeks before we get the final answer to this. Obviously, it's very shocking that a 4-year-old would die from any type of COVID-related illness. So that was part of the reason why we were very interested in the autopsy results, because we want to know whether she had underlying conditions that people were not aware of, or perhaps maybe there's something about this particular strain of the virus that not only was found in her, but also ripped through her family and made all of them very sick very quickly. That contributed to it. The preliminary results of the autopsy so far, again, are very consistent with her dying from COVID, and that's all the information we have at this point.
And should point, it's an important part of it. So far, the examination has shown
that's
that
correct.
It was likely COVID.
Right. And we don't have a final cause of death yet.
Is it though? Was it a mistake? Did it come out so quickly? In that, I mean, and I want to go over the sequence of things here. Is that obviously folks in the community were talking about it first, then the principal of the school announced it publicly,
right?
Then your office, when being asked about this, got with the medical examiner and said yes, it's COVID. Then the health district released that, and then it was the next day said, whoa, hang on, there's some questions about that. Are there going to be some changes in procedures when it's an unattended death, meaning not under the care of a physician at the time? Do you see that forthcoming not only within the health district, but as the medical examiner told you that at this point?
Yeah, I do think that we're going to, once we get put this particular case behind us, we're going to get together and talk about the ways that deaths are signed out as COVID.
And I'll put it this way: was it wrong then to come out with the information the way it was, or was it what? It was just a
Let's just say it was
miscommunication.
And if I had to do it all over again, I might do it differently. But we at the time, the information we had, we were working with the best information that we had at the time, and it was already out there on social media and in the press, and the family was being vocal about it, and so we knew we were going to be asked about it, so we proceeded with the best information we had at that point. But then as we started scratching our heads about this and saying, well, wait a minute, there are a lot of questions here. Let's go back and revisit this and make sure we got this right.
And kind of a question here on it, though, too, is that, you and I have talked about this, and we can see it in the comments every single time. Folks are going to question when they say, we've seen the folks say, oh, it was a gunshot wound, but they're going to call it COVID anyway because they tested positive. Right. What assurances can you give to folks? Because this one case right here, took a lot of folks that were doubters and gave them a big voice saying, look, see, this is all rigged up. What assurances can you give people that when this data comes out at noon every single day from the health district and it says someone's died of COVID, that is the absolute truth?
Well, if I think this case should reassure people, right? So it's a case where there were questions, and we're going back and we're relooking at it. So we're not just whitewashing things and saying that that cases are due to COVID. We don't count gunshot wounds of people who have a positive COVID test as dying from COVID. We review all of those cases. We've had that happen. We've had people who've died of trauma. Sometimes we have gray cases too. Sometimes we have elderly people with lung infections and bad heart disease and dementia and everything else, and they die. And it's hard to say, was COVID the primary cause of death, or was it a contributing cause of death? And in those cases, we report them as being COVID deaths, because we get accused of doing the opposite too. Just as we have people who say, oh, you're not counting COVID deaths because you're trying to undercount. We have people who people who say we overcount. We have people who accuse us of undercounting as well. So we do our best to get it right. And in fact, if you look at the state's website, you will see that we've actually reported fewer COVID deaths than the state has reported. And that's because we take the time to vet every death and to the best of our ability, make sure that we're giving you the right answer for each case.
To give it kind of in context here, how many of most of these cases would be similar to Kaylee Cook's, where there was unattended death?
Oh, that's very unusual, actually. That's a very unusual case, and that was one of the things that, as we investigated the case, was that gave us pause.
And again, waiting on the results from that to come down the line. A lot of folks getting in everything about this. The question we get too, I like to bring this one up every once in a while, says, whatever happened with the flu? We're not reporting those. And you have said this in the past, people making more of a social distancing issue, but we're actually not into flu season yet either, really fully. And that we don't know what flu may do coming around the corner. So I know I got the phone call from my doctor here saying, hey, have you gotten your flu shot yet?
Yeah.
She already knows the answer, obviously, when I get the phone call. But again, too, what about the flu? Last year we did talk about this. Hey, look, when it was middle of flu season, we weren't seeing as many cases, and it just bottomed out. And that was mainly because there were mask mandates, or folks were really into that. Do you expect kind of the similar this year, or now because we saw those spikes in COVID cases and now also having classes in person versus last year at this time, that we're probably going to see flu spike again?
Yeah, it wouldn't surprise me if we see a flu spike. We saw an RSV spike this summer, and a lot of kids who were thought to have had COVID actually ended up having RSV, respiratory syncytial virus. And so as we're moving into flu season, I wouldn't be surprised if we see flu. I mean, I certainly don't want to get flu and then get COVID on top of it. So I'm going to get my flu vaccine. And if we have a lot of flu cases, I'm putting the mask back on. So, I never used to be really big on wearing masks, but boy, after seeing what happened last year when everybody was wearing masks, I think that during flu season, even when COVID's gone, we should make all our hospital staff wear masks.
I got into on the mask thing too. That we were starting to see everybody got in the mask business too, all the cloth masks and everything else. We're just seeing some places saying, I went into a place the other day, and they said you need to swap out your mask, which I had a cloth mask on, and please put one of these on. And it was the surgical, not the N95, obviously, which is what I use in the hospital, but that it was one of those, what you see called the surgical mask.
Right.
Are you seeing more and more of that now as a precautionary of, not the cloth mask, you need to go with what we know are medical grade?
Yes. So for anybody that comes into the hospital or comes into the health department, we provide them with medical grade masks, and we have plenty of them, and it just makes it so much easier. And in that way, you also avoid the issue of, no, my mask's fine. No, it's not. Well, it's not quite as good. Well, how not quite as good is it? So it just evens the playing field and makes it a lot easier.
And it goes into, I got this the other day from someone to show me this, say, look at the side of the box of these masks. And it says, does not prevent you from, getting stuff. Can you explain the real reason to wear a mask? It's not really to protect yourself so much as it is not holding back stuff at bay. Can you explain that to? I know it's basic and we've done this 100 times.
Yeah. I mean, and we've gone over this before. I mean, you're right. It doesn't prevent. They're not perfect. They're very, very imperfect ways of preventing disease. And it does two things. One, by having this barrier over my face. If I were to cough right now with this barrier over your face, you wouldn't see little bits of snot hitting the screen of the camera, the lens of the camera. And that could happen to you if you were standing in front of me. So that's one of the most important things. It helps me from giving it out to you. And then it also does, as it decreases the amount coming this way, if you're breathing the same thing on me and you have a decreased amount, it's going to decrease the amount that I get on me too. So it does work both ways, but it's primarily keeping me from breathing it out. And that's why it's important to wear masks.
Dr. Philip Keiser, the local health authority for Galveston County, has been on with us today. I know you got to get on out, and we will gather again here next Tuesday, 2:30. Make sure you submit your questions there. We'll let you get on to your meeting. Thanks, Dr. Keiser. Appreciate it. Any final words before we wrap up here today?
No, just, same thing, same song, different day. Get vaccinated, wear a mask, be careful out there. And, we're getting closer and closer, so we just keep pulling and we'll get through it.
All right. You've been watching What You Need to Know with Dr. Philip Keiser here on I-45 Now.